Hi, my name is Godwin Losey. My partner is Ruben Avila, and we have chosen to speak about schizophrenia. We are going to explain to you what schizophrenia is. First off, I want to start by showing you an image of a human brain with schizophrenia brain and without.
Alright, as you can see here, PET scans are computer-generated images of brain activity. When compared with PET scans of healthy people, the scans of people with schizophrenia show disruptions in brain activity, changes in brain structures like the ventricles, and decreased functioning in the frontal vortex. Alright, as you can see right here, is a person with a normal brain. There's no disruptions, and you see this large red little thing right there. That's a disruption in a person's brain with schizophrenia.
Schizophrenia is a chronic disorder that has occurred and happened to many people throughout time. Patients or people with this disease do not make any sense that cannot function well psychologically. They can also change or alter their judgment when talking to others. Lives of schizophrenics can bring many stories. They can be a burden when trying to care or hold a job. In the U.S., 1% of the population have schizophrenia. Schizophrenics have hallucinations that may cause them or have them to hear or smell or hear or say things. This diagnosis is presented as normal for them. Schizophrenics are on high alert and have a hard time of trusting anyone. They also can have a case of paranoia. This will allow them to be on alert on pins and needles always. This is considered to be a delusional behavior of theirs. They are also have a speech impediment that will make them mutter when they talk. Most of the time, people with schizophrenia will get this at the age of 45. Both males and females can get schizophrenia. It occurs at a similar rate in all ethnic groups of the world. Men are more dominant to getting schizophrenia than women will in their lifetime. In the frontal lobe part of the brain, schizophrenia can cause the brain to not problem solve or critically think on high reasoning levels. Perturbation in schizophrenia leads to difficulty in planning actions and organizing thoughts. Despite belief that schizophrenia is not dissociative identity disorder, multiple personality disorder, schizophrenia can also cause repetitive behaviors such as pacing. In common cases, they are stereotyped as high risk of violence, which can be so small.
Here's another image of human brain with schizophrenia. You can see it starts off when the patients were first seen. My bad. Patients were first seen. You can see there's very small disruptions in the brain, and 5 years later, the same subjects were tested and taken PET scans, and there's just disruptions all over the brain.
Some schizophrenics have abnormal ways of thinking. They will sometimes disorganize their thoughts, which is hard for them to decipher which is real or unreal. They do not do well in large crowds or groups. This will set off a panic in their minds as a form of showing that people are against them.
What's going on, Ruben? Schizophrenia is a chronic disabling brain disorder that affects about 1% of Americans. My bad. 1% of Americans, so it may cause people to hear voices or see imaginary sights. It's really a complex illness. Health experts are not sure what really causes it. There has been an agreement among scientists who study schizophrenia say that what really causes it interplay between biological disposition and environmental factors that play a role later in life. Okay, man, come on. Schizophrenia and a number of other mental illnesses is caused by a combination of biological, psychological, and social factors. Schizophrenia in children is rare. It usually begins after age 5. Since children get this mental disease so rarely, it's hard to tell whether it's autism or some other developmental problems. Symptoms develop over months and years. This disease occurs in men just as much as it does in women, only women have milder conditions. Early symptoms include irritable or tense feeling, trouble concentrating, trouble sleeping, and when the illness progresses, worse symptoms are hallucinations, isolation, reduced emotions, problems paying attention, delusion, and speaking in a way that makes no sense. Medications, my bad, in a way that makes, okay. Usual treatment is medications like antipsychotic medicine, which is the most effective. It changes the balance of chemicals in the brain and it helps symptoms. Sometimes it's the exact opposite though. Sometimes doctors give medicine that cause chemical imbalances that could lead to another episode. Side effects from antipsychotic medicine includes dizziness, feelings of restlessness, slowed movements, and weight gain. Long use of medication could possibly cause tardive dyskinesia. This condition causes uncontrollable movement. There is no cure, but treatment can usually control the most serious symptoms. People with schizophrenia experience disruptions in ordinary reality. Through art therapy, they are able to express their energy and subconscious in a creative and uninhibited way. Schizophrenia is a lifelong illness. In most cases, long-term medication is essential to managing schizo. Weight gain is often a side effect. I hope this lecture gave you some insight on what schizophrenia is and how it works and how it affects the human brain. Thank you for watching and happy holidays.